This winter surge of COVID cases has affected even those who are fully vaccinated, boosted, and have been doing all the right things.
Yeah, and it's leading to feelings of shame for some people. Joining us now to talk about this is Dr. Ashley Zucker. She's the chief of psychiatry with Kaiser Permanente San Bernardino. Doctor, thank you so much for joining us.
Thank you for having me.
Yeah, so the big question, many people, they've spent the better part of 2 years, a very long 2 years, being proactive, masking up, getting vaccinated when possible, boosted, being careful. But now, with the explosion of the cases, even breakthrough cases, have you seen an uptick in the number of people contracting COVID and then feeling shame like they potentially did something wrong?
I think that shame and guilt has been there all along, whether the cases have increased or not. I think there are a lot of people who are trying really hard to keep their mask on, to get vaccinated, to get boosted. And then when they do get infected, which, does happen because nothing is 100%, there is a lot of judgment that goes along with contracting COVID. And so people tend to really take that to heart and really feel terrible about themselves or about putting their loved ones at risk as well. And so that carries a lot of weight and a lot of emotion with it for sure.
So then, doctor, how do you keep people from blaming themselves for this?
Yeah, I think it's really important to remember that nothing is 100%. I think the other thing that's important to do is really to accept the emotions that come with all of this. It's a very emotional 2+ or 2 years, maybe more, for all of us. And so accepting our emotions is often the first step. I think the other thing that's very important to remember is that so much of what causes all of these emotions around COVID is the uncertainty that's paired along with it. Each step of the way, there are different uncertainties. And I think we're still in that uncertainty of how long will this last. And so really focusing on what are some of the things that you can control and really feeling like you can bring yourself back to that place of having at least some certainty or as much as you can. So continuing to wear a mask, to quarantining when it is appropriate and following the CDC guidelines and getting vaccinated and getting boosted as well as your family members are things that you can control and things that you can do. And that can really help you to also feel that sense of control. I think it's also incredibly important that we give ourselves grace and we give others grace as well. This, again, is a very difficult and very emotional time, especially as we're going through the holidays right now. And I think that just adds a whole nother layer of weight onto everything.
Yeah, it's hard to believe it's been 2 full years. And, as we mentioned, as a whole, it feels like we're living in a very judgmental time, especially when it comes to COVID. So how do you think overall that's affecting people's mental health?
Well, I think as human beings, we tie a lot of our self-worth into what other people think about us. And if we're not feeling good about ourselves or we have poor self-esteem, that can certainly lead to things like depression. It can also lead to things like anxiety as well. And so you do see that this impact of just kind of judgment across the board and also just the access to judgment through social media and the different ways that we connect nowadays, I think has also increased that sort of sense of judgment, which then again leads to, potential problems with depression or anxiety. Some sense of feeling sad, blue, feeling a little bit worried is very, very normal. But if those things are persisting or they're starting to interfere with your ability to really live your life, that's when it's incredibly important that people reach out to their primary care physician or to their mental health professional and seek some additional help.
Yeah. All right, doctor. Such good advice. I mean, like you said, have grace. You never know what someone else is going through. So we can all be kinder to each other and be aware of these issues. Thank you again, Dr. Zucker.
Thank you so much.
All right, still ahead.